Imagine you're in rural Georgia when suddenly you get a knot in your chest. A deep thrashing pain radiates across your body, causing a shortness of breath and striking panic. You realize that you need an echocardiogram, where sonographers take images of your heart. However, the nearest hospital is hours away and there's a shortage of sonographers. You are now worried about your access of care. Unfortunately, this is the reality of many, especially those in remote or understaffed areas.
The current standard of care in such scenarios involves highly trained sonographers conducting echocardiogram procedures in traditional hospital settings. Despite the importance of these procedures, rural hospitals, more often than not, do not have trained sonographers who can conduct an echocardiogram. Even high-resource areas suffer from overbooking in their echo labs stemming from a high demand for these procedures. Thus, more often than not, patients are unable to get the cardiac care they need.
The main stakeholders we aim to serve with our medical device are patients in need of an echocardiography procedure due to various cardiac complications, sonographers, medical staff at hospitals overwhelmed by the demand for echocardiography, and cardiologists who want a new way to do echocardiography. There's a clear market need for our device indicated by the $2.39 billion a year market for ultrasound diagnostic equipment. Our total addressable market is based around the 7.1 million echocardiography procedures performed in the United States every year. And our service addressable market is based around the 2.3 million echocardiography procedures performed in rural areas in the United States.
Team Heartmonics has developed the Echo Strap, an innovative device to promote remote cardiac imaging. The device has a unique ring to secure an echo transducer in place on the patient's chest, which is then strapped around the patient's chest using a comfortable belt strap. With our ultrasound probe holder, we are implementing a rotating latch that allows the probe to be precisely turned up to 90 degrees, streamlining the process of attaining the various necessary angles of the heart to make a diagnosis. With our strap, we are introducing a way to easily adjust the tension on the belt.
Our testing journey has been challenging but rewarding. We have done two types of testing, verification and validation testing. In our verification testing, we're focusing on things such as durability of the holder being pressed down and the strap tension, the force to activate safety mechanism, and the probe holder staying in the same place with strap tension. For validation testing, we're focusing on how long a medical personnel is still in the same room as the patient when the procedure is being done.
Our device allows for echocardiograms to be performed remotely while also providing a comfortable solution. The strap that we use has a fail-safe safety mechanism to ensure user control and control of strap tension. The device also uses biocompatible materials and is user-friendly and intuitive. This allows for users to adequately conduct cardiac imaging on themselves using our device, and especially can provide value to the user and other healthcare provider stakeholders when there is a lack of sonographers in a given area, lack of resource concerns, or access to care issues.
Currently, our next steps involves further advancing our patenting process by working closely with Emory University as well as the VA hospital. In terms of organizations that we can work with in the future, we hope to work with government programs, nonprofit organizations, as well as rural clinics in order to further address this issue of underserved as well as underprivileged populations within these rural areas. For our FDA application process, we aim to further go down the 501(k) route. Specifically, we aim to do further predicate device investigation as well as clinical testing. And for the resources we'll need for this process, we will need patent lawyers, staff for these clinical testings. And finally, we aim to partner with third-party companies in order to further along our FDA process.